Hello, my name is Mary Costello. I am a student at San Francisco State University in the Masters of Science Nursing program. Welcome to my N706 Leadership Project. I will be discussing a relatively new but very important topic, HCAHPS, and the quietness of environment. What does HCAHPS stand for? It is an acronym for Hospital Consumer Assessment of Healthcare Providers and Systems. It is commonly pronounced HCAHPS. What is HCAHPS? It is a 32-question patient survey. It is national, standardized, and publicly reported. It looks at a random sample of adult inpatient discharges. It is administered by mail or phone. It is required by CMS, which is the Centers for Medicare and Medicaid Services, and it measures patient perception of how often they felt they received high-quality clinical and customer service. This is a copy of the first 2 pages of the survey, which you can see on the HCAHPS online website. What does HCAHPS measure? It measures communication with doctors and nurses, responsiveness of hospital staff, pain management, communication about medications, discharge information, the cleanliness and quietness of the hospital environment, and the overall rating of the hospital. Why is HCAHPS important? Well, it raises the accountability in healthcare by increasing transparency. It assists consumers in decision-making regarding their choice of hospitals. And because Medicare reimbursement will be partly based on the hospital's HCAHPS scores. This marks the first time that the patient's perceptions regarding the quality of nursing care will be directly linked to hospital reimbursement. This is the Hospital Compare website. It is very easy to access. Just type in a zip code or city and choose what hospital results you would like to look at. You can compare up to 3 hospitals at once. Now that I've given you a brief overview of HCAHPS, I want to focus in on question number 9 on the HCAHPS survey. During this hospital stay, how often was the area around your room quiet at night? I was dismayed to see that only 41% of patients say it is always quiet enough to sleep at night at St. Mary's Medical Center. Although quietness of environment consistently receives one of the lowest scores, St. Mary's is still below the California average of 51% and a national average of 62%. These results are from the year 2014. The scope of the problem. The World Health Organization recommends a maximum of 30 decibels for patient rooms. Hospital noise can range as high as 67 decibels in the ICU to 42 decibels in surgical units. Patients report the most common sources of noise to be staff conversations, roommates, alarms, intercoms, and pagers. Hospital noise has been linked to adverse health outcomes such as elevated blood pressure, decreased immune response, increased pain perception, and delirium. What are the contributing factors? Well, nursing activities, such as talking in the hall and at the nurse's station, especially during change of shift report, devices in the hospital environment, such as noisy wheels and doors, overhead paging systems, clinical and equipment alarms, such as IV pumps, and call lights. Also, the early morning scheduling of tests, such as lab work and chest x-rays, are often done at 5 a.m., so the results are back when the doctors come in for their morning rounds. The video you are about to see illustrates this issue.
Let's face it, noise is annoying. It also demonstrates a lack of concern for patients, coworkers, and family members.
Good morning, Miss Bell. Good morning. Remember, my name is Trish, and I brought you some pain medication for your pain from your surgery. This is for your pain.
Did you say it's going to rain?
No, this is your pain medication.
Oh,
Let me check your ID band before I give it to you. Okay, that's your name and your birth date.
I thought you said that I bring my pen.
No. pain. This is for pain medicine, for your pain.
Pain, okay.
Okay.
Noise in the hospital setting is becoming a more predominant issue. Whether you're talking about your HCAHPS scores or patient satisfaction surveys, noise level measurements are very important. So how do we keep the noise level down? Be aware of how loud, how long, and when you talk. Hold your conversations in appropriate places. Avoid calling out, yelling down the hall, or shouting. See whether you can move, place, open, close, pull, push, put down, roll, wheel, and slide things more quietly. Take extra pains to avoid making banging, bumping, or slamming noises. Adjust the volume of your voice according to where you are in the hospital. Have the guts to be a quiet advocate. Remind people that you're with, "I think we're getting too loud." Be sure to answer your telephone quickly, and when possible, keep the volume of the telephone chime turned down low.
In a review of literature, researchers Murphy, Bernardo, and Dalton found a 7-step approach to noise reduction. 1. Get everyone involved. 2. Assess the sound environment. 3. Establish sound standards. 4. Establish equipment maintenance. 5. Select patient-appropriate equipment. 6. Educate staff and model sound-sensitive behavior. And 7. Measure results. These researchers also suggested strategies for noise reduction. Identify an RN who can serve as a unit champion. Close doors at night unless there's a safety concern. Provide earplugs and printed material about noise reduction at night. Perform change-of-shift handoff in break room. Provide headphones to patients who watch TV at night. Institute quiet hours from 9 p.m. to 6 a.m. Dim the lights. Avoid conversations in the hall. Do not use overhead paging. Display banners explaining quiet hours near elevators. And ensure that patients and visitors know about quiet hours. In a literature review, researchers Konkani and Oakley found that educational noise reduction programs to be the most effective and least expensive. That installation of noise meters that measure decibels and light up when sound exceeds certain levels are helpful reminders. A quiet time protocol is a helpful reminder to encourage a change in hospital culture. And low-cost environmental repairs, such as fixing a noisy wheel on a Linda cart, are effective. Massachusetts General Hospital developed guidelines to address quietness on hospital units, which included forming a quiet environment committee, conducting a quiet time assessment for each unit, asking for staff volunteers to be a patient for a night, installing devices that promote awareness, such as the Yakka tracker, a self-monitoring traffic light sound meter, and using key statements such as, "Sometimes our voices seem louder at night, so please let us know if we are bothering you or if you cannot sleep." In a study by Li, Wang, Wu, Liang, and Tung, guidelines were implemented and found to improve the sleep quality of patients in a surgical ICU. Interventions included shutting patient doors at 11 p.m., dimming the lights, decreasing the volume on telephone rings, lowering the volume on bedside alarms, responding to alarms within 1 minute, rescheduling of routine tests from 5 a.m. to 6:30 a.m., such as portable chest x-rays and lab blood draws, and lowering the volume of staff conversation after 11 p.m. In conclusion, the HCAHPS survey has changed the healthcare environment by making it more patient-centered, transparent, and financially accountable. There is significant opportunity to improve the patient's perception of noise. A combination of many little things can have a positive impact on creating a quiet environment. And, for the first time, nursing care has a direct impact on hospital reimbursement. Nurses must accept the greater accountability that exists with their care. Thank you for watching this presentation on HCAHPS and the quietness of environment.